You know, oftentimes on our show, we've done shows in the past on physical therapy with Scott Pensivi over at Sports Physical Therapy and at Fyzical. And R.J. Williams, you've been on our show before talking about balance, and now Dan Deems, Dr. Dan Deems is here. And you know, it's really interesting when, and I talked to Steve Shore earlier in the show about the number of falls and how prevalent they are in our country, and you feel like so much of it's preventable.
Well, it's true. It really is an epidemic in the U.S. It turns out this year, close to 35,000 people will die from a fall. That's the equal number to people dying from motor vehicle accidents. And the death rate by falls has doubled in the last 6 years. You know, when we actually focus on falls, when people become aware of their balance challenge, there's a great way to reverse it. We have technologies at Fyzical where we can rehab someone's balance system to actually make them better than the age and gender matched controls. And it's really exciting, and most of the people really, frankly, find it fun.
So give me an example of how this works. You know, look, I'm getting up there in age, and I noticed when I was younger, oftentimes I fell because I was in a big hurry and not paying attention. Now I could just be, you know, walking at a normal pace, and just maybe I'm not paying attention still, and just, you know, all of a sudden I start to lose my balance. But I'm, you know, I'm pretty active, so I'm good at maintaining standing up straight after I, you know, fall on something, maybe start to fall on something. But you know, all right. So for somebody like me, somebody reaches a certain age, what is it, 50? You evaluate people?
Exactly.
When they start to lose some of that balance center?
Exactly.
So you go into a balance center at Fyzical, and what would you do to me?
Well, RJ, why don't you describe,
Sure.
RJ is one of our doctors of physical therapy. Why don't you go ahead and start with how we would do that?
So your balance is really a dynamic relationship between a couple systems working. So your musculoskeletal system, your bones, your muscles, your joints, your visual system, and your inner ear system. And so we have to do an assessment to figure out what, if any, in those are maybe causing some of your balance problems. So if we can see with some of the testing that we do at Fyzical where those problems lie, now we can start to apply specific interventions to help those get better.
When you say interventions, are these exercises?
Yeah, and Dan and I were joking actually on the ride over here. A lot of people sometimes when they think rehab or exercise, PT is always pain and torture. But really, our patients are high-fiving each other. They're having fun in the clinic because we're doing activities that starts to, I think, improve their confidence, improve their psychological state, because they're getting better and they're getting more enjoyment out of their daily activities because their confidence is improving. And so we're trying to mimic and recreate as much of that in our therapy centers, and we have a safety overhead support system so the patient doesn't have to worry about falling down. So when we start saying, hey, we want to do these things that we know need to get better in your life, they can do it confidently and comfortably and not worry about sustaining a fall.
It seems like so many of my friends are going in for hip surgeries. You know, I mean, it can really be life-threatening, some of those hip injuries, and particularly with elderly people. So can you prevent through, you know, a proper balance, you know, some of these hip injuries?
So what I would say is, yes. I mean, the first is awareness. You brought up a great point. The most recent data from Duke University tells us that we start to lose our balance in our 50s. So first of is just paying attention to it. You know, you probably remember as a kid, you'd trip. And we all trip, and we would spin around like Snoopy, but we wouldn't fall down. Now our center of gravity changes, maybe we're hunched a little bit, and if our center of gravity is forward, you're gonna fall. I would start first with a single leg stand. And if you can't stand on a single leg for at least, realistically, 30 seconds, then you have a fall risk. And one of my fun patients we recently cured, he's only 95. After fixing his balance, he now stands on one foot to brush his teeth, and he stands on the other foot to shave. And what we've discovered at Fyzical is there is no age above which we can fix someone, and there's a point of neuroregeneration where we actually can recover many of these systems so we can bring someone back even beyond where we would expect them to be able to go. Our brains actually grow and enhance, and then what's fun is you see cognitive improvement too. We see people actually smiling and laughing, like RJ says.
And you've expanded that now, so even you can help people with back injuries and cervical injuries just, by working on their balance?
RJ, it's your area?
So yeah, we know that the musculoskeletal system and the nervous system work very closely together. And so what we know is people that have been dealing with chronic pain, we see the same changes occurring in their balance systems as well. So we've kind of started talking in the conversation that, maybe we've been looking things incompletely. Maybe people that are dealing with some of these chronic pain issues also have some balance deficits that aren't being addressed. And when we start to put the stuff that we've always worked with Scott on, together with our balance therapy, we're seeing greater and greater outcomes with these patients getting healthier, getting out of pain, and feeling more active every day.
Because there is some sort of connection between, I guess, how you walk, what your posture is, and your back issues, and right. I can remember years ago, I went to a chiropractor one day, and he said, "You keep your wallet in your back pocket." I said, "Yeah, why?" So that's throwing off your balance,
Sure.
and that's going to affect you. Was he right?
Well, I was going to say, and imagine if you were concerned about your balance, even at a subconscious level, you're going to walk more stiff. You're going to try to lower your center of mass, so you're going to always be engaging certain muscles that are going to, again, fatigue out areas that we really shouldn't be overutilizing in our day to stabilize our balance if we just could balance better to begin with.
And why does this medical? I was trying to actually give it a category. The balance. Is there a medical subsection that's called? What is the proper name for what you're doing?
So we use the term musculoskeletal balance disorder.
Okay.
At Fyzical, yeah.
Right. Okay, so taking the musculoskeletal balance disorder and combining it with physical therapy.
Right.
Right, and the two have to mesh together to work, right?
Yeah.
Because you can use technology and all the great new gadgets that you guys use to test a balance and try to correct it, but also it's a matter of some physical therapy to strengthen muscles and surrounding tissues and tendons, right?
Correct.
Right, you can't separate the two. We find people with low back pain have vestibular inner ear balance challenges. Even some people we've discovered who have fibromyalgia, the chronic muscle pain, actually have balance challenges as well. So we've discovered it's like the Reese's peanut butter cup. You can't separate the two. You can't take care of balance without taking care of the musculoskeletal system, and vice versa. Mm-hmm. And utilizing the balance program, and then Scott Pensivy is very high level musculoskeletal rehabilitation that he uses in all of his pro athletes. We've been able to test it and find ways to not only improve balance and overall body health, but in some instances, even in our athletes, kind of turn into performance enhancement, working on both of those systems together.
You, Dr. Deems, are an ENT.
Correct.
So somewhere you made the transition from sinus infections to balance. What caused that?
I have a very weird background. I also have a PhD in the neurosciences, so I've always loved the inner ear and the balance system. And Fyzical has been focused on physical therapy and balance, and it was a great mix where I could utilize my studies of the vestibular inner ear, and really take a truly preventive approach to medicine. Unfortunately in medicine we're very reactive. You break it, we fix it, and so this is an opportunity in my career. I've always focused on prevention. Now we can prevent tremendous disease. We could, if you just take half of the falls, we'll spend about $50 billion this year on falling. If you take half of those falls, if we could teach people to stand on one foot, to pay attention to balance, and to not fall, we spend about $89 billion on all cancer treatment. So we could basically make 1/3 of all cancer care free just by focusing on balance.
Amazing. Give me one exercise that people can do at home right now.
So I love the single leg stance piece as well. I'll ask.
So single leg stance, okay? So you just stand up,
stand on one
just
foot.
like this, right?
You got it.
And you started perfectly. I always tell my patients maybe keep some fingertips down on like a counter,
Right.
something stable, and then just practice just lifting that leg up for a few times. And then when that starts to get too easy, go ahead and start to practice lifting that hand. But you can always kind of come back to that. But you've got to slowly start to take the training wheels off, and that's what that hand is on the bike.
Right.
And then once you can balance and you can go, then you can start to progress it even further.
So you can improve your balance. When you trip or start to slip, you can regain your balance easier, better, right? From improving your balance by strengthening your legs and your
Right.
balance techniques. How about for your inner ear? Give me one warning sign that you have a problem with something going on in your ear.
Well, that's a great question. You know, for instance, positional vertigo. Everyone's heard about the stones floating around the ear. If someone has some dizziness or vertigo when they get in and out of bed, or putting their head back at the beauty parlor, that's an inner ear problem. That's one of our most treatable things, and it shouldn't be given medications and whatnot first. Seeing a vestibular trained physical therapist like Dr. Williams, where we can actually fix that on a few visits once and for all. So that's a good place to focus.
Thank you very much, Dr. Dan Deems, R.J. Williams from Fyzical with an F.
Thank you very much.
Thank you, guys. See you next week. Fatigue causes 72,000 crashes a year. One pedestrian is killed every 2 hours. Bicycle injuries result in 500,000 ER visits a year. Be careful, be safe, and stay alert.
at Bernstein.com.